Now, the UK's latest R rate is now between 1.2 and 1.5, meaning every 10 people will infect between 12 and 15 others. It comes as Wigan joins the rest of Greater Manchester in having a ban on mixing in households. Meanwhile, London has been added to the UK's COVID-19 watch list. And while no new restrictions will be put in place, the situation will now be monitored closely. However, Leeds is likely to face new restrictions from midnight tonight. This could see restrictions on household mixing falling in line with the rest of West Yorkshire. Well, meanwhile, a study of the government's Test, Trace and Isolate scheme has found the vast majority of people aren't self-isolating when they develop COVID symptoms. It's found that less than a fifth of those who develop a dry, persistent cough, sweating or loss of taste and smell actually went into self-isolation. Adherence was even lower for those contacted by the Test and Trace system, with only 11% going into quarantine. Well, the study found those least likely to follow the guidelines were men, younger people, the economically disadvantaged, those supporting children and those working in key areas. Well, I'm now joined by an expert in communicable disease control. That's Dr. Bharat Pankhania. Dr. Pankhania, thank you for joining us. Many people, as we heard from those stats there, aren't following the rules. That's critical for stopping the spread, though, isn't it?
It's very critical, and the evidence is clear for us to act upon. We know that this is happening, and what we really need to do is, with every case that we identify through the test system, we have a 5-minute conversation with them. We say to them, this is really important. You are breaking the law if you do not self-isolate. You are breaking the law if you circulate, and we need to emphasize and reinforce these messages. I would also advise that perhaps before major news broadcasts on TV, we have a 2 to 3 minute public health advisory clip every day to reinforce public health measures, infection control measures, and all the things that we should do now. Otherwise, we have a problem going forward.
Indeed. Why these demographics, though, in particular? Are they because they're people who are less likely to be able to afford to isolate?
That is absolutely one element as well, because a lot of people have got to, get a daily wage, and therefore I feel we should also support these people to adequately take off sick leave and stay at home and be safe and keep other people safe. This is very important. Also, to share with you, I'm talking to a lot of headmasters and head teachers, and I find that they're all giving me the same story, which is parents are reluctant to keep their children at home when they have obvious signs of a cold, a temperature, slightly unwell, off color. They haven't been tested, but the suspicions are they could easily have coronavirus and they're coming into school. Well,
if people aren't isolating, there's very little point to testing and tracing, is there?
It is. It breaks the system down, and therefore, as it is, our system is creaking at the seams anyway. And with the case numbers rising, we won't be able to do good contact tracing. So what can we do? I feel at least give out good public health messages and support the people who need to stay at home. This is important. And one more thing. Look, the budget for test and trace is 12 billion. That's a lot of money. It's equivalent to the entire GP and public health budget in one. And if we were to do this locally, the local test and trace, it would be cheaper, better, and we would be able to more control the demand on the tests. At the moment, testing is a free-for-all.
Indeed. Dr. Bharat Pankhania, many thanks for talking to us.
Thank you.